Good evening, everyone. My name is Neng Daryanti. I work in Bhakti Kencana University, Tasikmalaya. Today, I am going to be talking my research about seeds better lips or paper better technical on healing of postpartum woman perineum cells. Which motivated me to do research as follows. Maternal mortality rate or MMR is one indicator of the degree of woman's health. High and low MMR in an area uses an indicator that illustrates the magnitude of her problems, the quality of her services and resources in a region. According to the Ministry of Health Republik Indonesia 2016, causes of maternal death are hemorrhage 30.3%, hypertension 27.1%, infection 7.3%, other 40.8%. Postpartum care should be considered as an estimate. 60% of maternal death due to pregnancy occurs after delivery and 50% of death during childbirth occur in the first 24 hours. Say about 50% of death in the postpartum period in the first 24 hours after childbirth, which are caused by complications during childbirth. According to research, postpartum complications include mental health, genital infection, breast problems, and bleeding. Worldwide in 2017 occurred 2.7 million cases of rupture of the perineum at birth. Mothers in Asia. Rupture of the perineum is a considerable problem in the community. 50% of the rupture of the perineum in the world occurs in Asia. In Indonesia, perineal lacerations experienced by 75% of mothers give birth patiently. In West Java, case perineum rupture occurred almost 90% of all mothers delivered. The perineum laceration is one on the skin-covered muscular area between the intratus vagina and anus caused by a tear because of childbirth. Perineal care that is not correct resulting in the condition of the perineum are exposed locia be dumped and will support the proliferation and bacteria that can cause infection in the perineum that can inhibit wound healing process, so that the need for care in the stitches of the perineum, one of which is the seedbed better lives. Seedbed technical is warm water therapy method that aims to treat and clean between area the vaginal opening and the anus. This method helps the healing stitches after a normal delivery, reduce pain. For relaxation, the usefulness of the seedbed that can be used for patients who have undergone surgery in the rectal area or too easy to discomfort of vaginal pain. According to a perineum after urination and defecation from backward, a swab, then tissue discharged. Seedbeds provide pain relief and improve drainage, in addition to improving blood circulation to the affected areas, which helps speed healing. Better leaves contain saponins which stimulate the formation of collagen, the structural protein that plays a role in the wound healing process. Tafico is one of the components contained in the betel leaves, which can serve as an antiseptic. Green pepper betel contains is the essential oil that contains, among others, cefical and sepi betel are compounds that have antiseptic properties. Antiseptic was allegedly closely associated with their use as inhibitors of bacterial growth in the wound. Result of a preliminary study carried out at the Heart Center Bungur Sari Tasikmalaya City found that maternal mourn from January to September 2080 73% of women experienced rupture perineum and 6% of mothers were infected. Of mothers who experienced an operation patient rarely maternal perineal cleansing one because of fear for cleansing one sealing one's perineum so much longer that is longer than 7 days. This type of research is quantitative research with a quasi-experiment design with a post-test only control design. In this design, there are two groups. It's selected randomly. The first group was treated and the other group did not. The population is the whole object of research of data or data source, in particular research that has the number of lots and species. In this study population with all over pure floral women in Bungur Sari, Heart Center Tasikmalaya City. As many as 34 people. The samples in this study using purposive sampling techniques. With sampling with purposive sampling is because not all the samples have the criteria according to which the author has specified. In this study, the sample was divided into two groups. 70 in the experimental group treat with seed but betel leaves, and 17 control groups who do perineal care using soap and water only. Univariate analysis using formula percentage and bivariate analysis using the Mann-Whitney formula. And this result of my research. The diagram 5 shows wound healing time frequency distribution perineum on postpartum mothers with seeds but paper betel technical in the working area Bungur Sari Heart Center Tasikmalaya 2019. Seed beds technical with betel leaves mostly has a pest category as many as 17 people or 88.2%. Based on diagram 5, 2 shows suggests that the time perineal wound healing in postpartum mothers in the working area Bungur Sari Heart Center Tasikmalaya 2019 when not given treatment mostly have slow category as many as 14 people or 82.4%. Result analysis seed but technical effect of betel leaves perineum wound healing time on postpartum mothers. Mann-Whitney test calculation result with a computerized system show the value of Z equals minus 4.21 or p value equals 0.00 where the value is smaller than alpha 0.00 less than 0.05. The declared hypothesis alternative accept. From the analysis, it was found that there was a significant impact of setback technical paper battle against perineal wound healing in postpartum mothers in Bungur Salihat Center, Tasikmalaya, 2019. The survey result revealed that the time perineal wound healing in postpartum mothers in the working area Bungur Salihat Center Tasikmalaya 2019 in the experimental group were given a suitable treatment had a mean healing paper battle for 4.28 days, including pass category, while in the control group who were not given the treatment, healing time had a mean of 6.182 days for the category later. Paper battle contains essential oils consisting of hydroxychapical, chapibetal, estradiol, eugenol, methyl-eugenol, carpacrol. 1/3 of essential oils comprising phenol and mostly chemical that gives a distinctive smell of betel leaves and has a killer bacteria 5 times that of ordinary phenol. Betel leaves contain saponins which stimulate the formation of collagen, the structural protein that plays a role in the wound healing process. Cepical is one of the components contained in the betel leaves, which can serve as an antiseptic. Green fiber betel contains the essential oil that contains, among other cepical and chapibetal are compounds that have antiseptic properties. Betel leaves also have the effect of antibiotics, helpful alkaline to stimulate the central nervous to increase the peristaltic movement so that blood circulation to the wound to be smooth, becoming more oxygen, thereby affecting the perineal wound healing faster. And finally, before I close my presentation, I want to make conclusion, and my conclusion of my presentation are in the group given a seatbelt treatment paper better perineal wound healing time, and most of the postpartum mothers had mean healing for 4.29 days include in the categories passed. In the group that was not given the treatment of perineal wound healing time mostly had mean healing for 6.82 days include in the category of slow. There is influence seatbelt paper battle effect of wound healing of the perineum in puerperal woman. I think I have presented all the content of my final assignment from chapter 1 until the end. That's all my presentation. Thank you for your kind attention. Again, thank you very much.